In the U.S., there are almost 5 million people with mild to moderate dementia, and studies show that about 70% are at home, either alone or with a caregiver, often a spouse. If people with mild to moderate dementia can stay home safely, this would save Medicare and Medicaid a great deal of taxpayer money. More importantly, this would provide those people affected with dementia their preferred environment. Indeed, it is important to allow all people the chance to stay at home whenever possible. Recent Johns Hopkins research studied more than 250 people with dementia living at home and found that 99% of the demented and 97% of their caregivers had at least one unmet need. The foremost unmet need was defined by safety issues, which increased risk for falling, such as poor lighting in walkways. Other unmet needs included not performing regular exercise, poor follow-up with healthcare providers, not having prepared legal and estate planning, and not receiving needed help with medications and activities of daily living. Researchers found that those with lower income, with depression, and with borderline rather than severe dysfunction had significantly more unmet needs. When there were at-home caregivers for those folks with early dementia, the caregivers were often not aware of these deficiencies. Add to all of this, the needs of the caregivers were often ignored or unrecognized. Remarkably, at-home caregiver stress and depression was one of the strongest predictors for an early move of the person with dementia to the nursing home. Methods to enhance a person's chance of staying at home are not difficult. Preparation for legal issues and estate planning should be done early and before memory loss. Other methods include providing raised toilet seats, grab bars in the bath and bedroom, properly tacked down carpets, good nighttime lighting, and proper day and nighttime footwear. Researchers also strongly advise providing enhanced support for caregivers, such as educating them about support services available like social services and occupational therapy and caregiver support groups. In addition, screening for and treatment of any caregiver's depression should be provided. This would go a long way in helping people stay at home as they age. Bottom line, most of us and our families are not prepared for the possibility of dementia as we age. If we prepare, we greatly improve our chances for staying at home.